Uh, Good morning, Sai Narendra. Thank you for switching on the videos. And thank you for giving me this great opportunity to read this book of Dr. Vijay sir, like The Theory of Suppression. We are into the reading into the cases now. And once again, great salute to our masters, Dr. Samuel Hahnemann and Dr. Vijay sir. Now, we were dealing with a child who was having a very violent cough, and we understood that it was a syphilitic cough. And now we are under a confusion like whether it is a tarantula patient, or is it a Merck, or is it a Medorinum. Are you all interested to go ahead? Yes? Even I am curious to know which medicine Dr. Vijay. Dr. Ariel, can you please keep yourself on mute, please? So now going straight into the case, are you all interested to know whether it is a tarantula? On seeing a certain half, we thought that it could be tarantula. On seeing a certain half, we thought it could be Merck. On seeing a certain picture, we thought it could be Medorinum, right? If one wants, one can easily fit in any remedy, yes? To prove a point, since most of the remedies have large number of symptoms. Sometimes a strong symptom like love for horses is stretched so far that the credibility breaks. This child even had love for ostrich, yes, then love for deer and all that. No, we should never go behind such rubrics. There are cock and bull stories framed to arrive at conclusions, which have started making homeopathy a part of Aesop's fables. This has been dissuading youngsters, demoralizing them, and convincing them that homeopathic practice is a real difficult one and is a monopoly of imaginative and hi-fi thinkers. So today it is more of theory. I'll just rush and read the paragraphs. Be close with me, that's all, okay? There is nothing to explain more. On the contrary, homeopathic practice is easy. Do you all think that homeopathic practice is easy? How many of you think that homeopathic practice is easy? Just give me an indication, no? A hand raise or something. Yes, Kailvi is smiling. Arati is smiling. Sufaira is smiling. Adira is smiling. Yes, somebody is saying it is hard. Arya is saying it is hard. Yeah. We all know that it is not that easy, no? Sometimes once the cure is elicited, we know that it is very easy. Or until the analysis is done, it is difficult. After the analysis is done, yes, Sai Narendra very rightly said, it needs constant practice, and that's what we are trying to do now here in the small portal. So, first of all, we should know what is to be treated in the patient. Then it will be much more clear. And then you have to frame questions and collect the symptoms according to what you need. So after that, you can put down the analysis. You can write down the JOD. Then it will be much more clearer, and then it becomes easier, right? So Vijay sir always says that it is all easy, na? He says, yeah, with lot of fond memories about Vijay sir. Let us read the next sentence. That is, all that you have to is to apply all your knowledge of materia medica, miasm, and use the repertory to guide you. If you don't use the repertory, what happens? You will just apply your thought of materia medica, knowledge of materia medica to some part which has struck you. When the patient says the complaint, there will be lots of stories there. It will be a maze of symptoms, as we say. But then from this, which one has to be given importance? Which one has to be not to be given importance? That is the real challenge, dears. So it is always important to take the innate thing, what characterizes the patient and what is the miasm, and according to that, what is the highest sentence, what is the highest miasm narration the patient has given you. Catch hold of that. And added on that, if you get any PQRS, that is well and good. Then you have to put it into repertory so that you will never be prejudiced to a particular remedy. All that one has to know is differentiation between remedies and what symptoms to give importance to in order to reach the minimum. As shown above, importance given to different set of symptoms will point out to different remedies. Yes, tarantula, Merck, Medorinum, etc. Which of the above is the real minimum? Any one of the above remedies are going to work partially. Most of such partially indicated remedies given by homeopaths show initial improvement in the symptoms and are projected and presented as fantastic cures by homeopaths all over the world. This happens. We will never wait, no? We will never wait for 1 year before we say that this patient is cured. After getting a 2 weeks improvement, we all are in a hurry to say that, okay, I have cured this case, cured this case. Most of such partially indicated remedies given by homeopaths show initial improvement. Yes, after 3 years, how has this patient responded? Or after 1 year, according to the case in front of you. For certain cases, you will, until you claim a cure, a 2 years or a 3 years, a full that much of amount of time has to be given before you publish, because it can relapse. After the improvement stops, there can be a relapse. If it is a partially indicated remedy, this very often happens. No one shows cure according to Herring's law. If you get the Herring's law, then it is mathematics. There is no doubt about the cure. The patient who comes with symptoms of cough or nervousness, agitated mind as XYZ symptoms are shown as the patient felt better. Patient felt better. Therefore, the remedy was a simillimum. It is more like a child story ending in and they lived happily ever after. So this is not how you have to prescribe. Initial improvement can be there, followed by aggravation, followed by what? That is most important. Yes. No symptoms or disease can disappear all of a sudden into thin air. Everything occurring in this world has a cause. Everything occurring in this world has a precursor and a follower. See how philosophically Vijay sir is putting this. Everything occurring in this world is a result of force or energy. As per the first law of thermodynamics and bioenergetics, the sum total of all of the energy is constant. Energy can never be created nor destroyed. It can only be transferred from one form to another. Thus, the effect shown on or manifested on any of our symptoms like GIT or respiratory tract, etc., has to be due to a cause inside the body, which is in the form of energy. The effect can change location from less important to more important system in the body in case of suppression, or progression of disease, or vice versa in case of cure. What does this mean? There is a sum total of energy there. How are we growing? According to the growth gradient, or according to the nutritional gradient. And where are these coming from? When the zygote is formed, at that time itself, this force, the vital force as we call it, or the force of nature or the energy or whatever that is there, and it has got enormous intelligence. It is the autocracy. It is able to control our whole body from head to foot in body, mind and spirit, and it grows according to its intelligence, according to the age. Whatever the age is, the next function comes in, the puberty comes in, the adolescence sets in, and the patient becomes an adult, and the reproductive function sets in. Everything happens according to the time. And then the old age sets in, the menopause or the andropause sets in. If the menopause doesn't set in, that is also an abnormality. One person can never be young too long. Anything, yeah, too much of sora is also syphilis, like Divya was saying the other day. So whatever, this intelligence for the body is nothing but the energy, or it is all going according to the gradient. So there is a sum total of energy in every body, and there is this energy can neither be created nor destroyed, but it can only be transferred from one form to another. So if it is a fifth layer disease, say for example, if it is a diabetes mellitus, and you have given the medicine, so energy cannot be created, it cannot be destroyed. The diabetes is gone. After giving the indicated medicine, there is no diabetes. What does this mean? Where has the diabetes gone? It cannot just go into thin air. So it was, that energy was converted into something else. Did it go to the higher layer or did it go to the lower layer? It cannot just disappear without any symptom. That is not possible. So it has to show out. It has to show out either in the sixth layer, a seventh layer, then it is a suppression. If it comes down into the third layer, into the second layer, into the first layer, then it is most welcome. That is the improvement of the case. No, this is what is said in this paragraph. In short, every homeopath has to look out for symptoms. If there are no symptoms, then gone. You have to wait. What is happening? Then it will be a time bomb, right? If there are no symptom after giving the medicine, the patient is all fine. Suddenly, the patient is all fine after giving the medicine. There are no symptom at all. How can you judge? There should be some symptom coming up. If there are no symptoms, then you know that this is going to be a act like a time bomb. Sai Narendra has got a question here. If in same layer again, yeah, if it's same layer also, we have got gradations. according to the gradation. Yeah, if it is in the same layer, say in the second layer, for instance, that is the endoderm, we have got the respiratory tract, and then we have got the GIT, and then you have got the GUT, that is the genitourinary tract. This is according to the gradation in the same layer. Okay, and in the third layer, you have got the cartilages or the bones. So if it is in the third layer itself, in the same layer itself, if the pain is moving from the neck, that is from the cervical spondylitis, the patient comes and says there is no neck pain, but then it has gone into the back. Now I have a back pain. So Sai Narendra, is it a good sign or a bad sign? It is in the same layer, no? But then it is reducing, no? From above downwards, improvement is there. And after the back pain is gone, the patient can tell you, no, like now I got little bit of knee joint pain, and then go to the ankle joint pain. Will the patient say like this, like ABCD? From the neck, it has to go to the back only, and then it has to come to the knee joint only, and then into the ankle joint only, and then into the feet. Especially in rheumatoid arthritis, you can see like that. I have given a patient a case for some rheumatoid arthritis. I had given pulsatilla for that patient. According to the symptom similarity, I had given pulsatilla, and the patient has narrated this. That's the reason why I immediately came up with this example from the neck pain, because no two symptoms are alike, or it keeps on changing, etc. No, week after week, the patient used to say, I have severe back pain, doctor. I'm not able to bend my back. Then I checked into my case record, and then I saw that the patient was complaining of neck pain the other day. Okay, then I asked, what about your neck pain? You were not able to turn your neck like this, like this. The patient said, no, doctor, I'm able to move my neck. I'm doing neck exercise regularly. But then now I'm not able to move my back. Okay, it is a good sign according to us. And the generals are better. What medicine will I give? You know what medicine I had given. And again, 2 weeks after, pulsatilla patient, no, they will come up again and again. Even if you want to see the patient after 1 month or 2 months only, the patient will come back and give you the feedback. Doctor, I am not able to walk at all. I am not able to climb into the auto, not able to climb into the car. My knee joint is hurting like anything. Again, when I gone back into the case history, okay, initially there was neck pain. Okay, it is coming about downwards. What is wrong? I explained her. I gave her again another strong medicine, wonderful medicine for our knee joint pain, and I consoled her. No, it is pulsatilla patient. You have to examine the knee joint and give her all sorts of comforts. Okay, make her move the leg and then give her the comfort. After that, again, to my dismay, the patient came back saying that I am having ankle joint pain. I said, yeah, this is what I said. Pehle hi, like it is coming about onwards. It's all very good sign. Don't worry, your RA is completely going away. Then the patient will start asking, no, so after this, what will happen? Then I said, maybe the toes can pain, or it can come up as a plantar fasciitis. Pulsatilla patient, no, it came up as a typical plantar fasciitis. And after that, it went into the gastric symptom. I told her that, okay, you can get gastric infections or gastritis. This patient also presented with a gastritis. So who gave us this much clear-cut indications? Dr. Vijay sir had given us this much clear picture. So Sai Narendra, I think your question is answered. Even if in the same layer, you have got gradations there. If it is a GUT, if the patient urinary tract infection, you have given medicine for that, and the patient suddenly gets gastritis, and the patient says that he passed loose stools. Is it a good sign or a bad sign? It is in the same layer. It is in the same layer. In the same way, hypertension case, I gave medicine, showed no hearing's law for 1 year. Now he started reducing weight. Then HbA1c, FBS, PPBS normal, GTT showed raised level, madam. Wow, Sai Narendra. So it has gone from the 4th layer to the 5th layer, right? It is slowly going there. So now with this, you know that the patient is getting improved or not. Whereas, see, only predictive homeopaths, we have this privilege of knowing this step by step, no? Like, see how Sai Narendra has ruled out HbA1c, FBS, PPBS, etc. But only the GTT showed the normal rise. So in that beginning stage itself, you will be able to catch hold of the disease. Dr. Beena was saying that it's a good symptom. Yes, the GUT, after the GUT, the GIT infections come in, that's a good sign. And after that, if the patient is getting a cough, then again, it's a very good sign. So in short, every homeopath has to look out for symptoms.
Ma'am, sorry to interrupt, ma'am. Ma'am,
Yes.
hypertension is getting reduced and diabetes is coming. Is it bad sign, ma'am?
Actually, it is a bad sign. according to the layer.
Patient started reducing weight, 5 kilo almost in a 1 year. He lost 5 kg weight.
If it is a healthy weight reduction, it is well and good. Hypertension belongs to the which layer? Fourth layer. And diabetes, that slowly the GTT is showing a rise.
Endocrine.
Means it is the fifth layer. Fifth layer.
So again, I reconsidered and again I changed the medicine.
If the patient is going ahead, what made the patient do the GTT? Is it because of the weight reduction?
Yes, madam. Because I have checked multiple times, madam. FBS, PPBS was normal and HbA1c was normal. And now in the GTT, it was.
Yes. So if the patient is worried about the weight
He doesn't have any complaint. I am not getting any conflict also. Any conflict also I am not getting. Patient is not worried about weight loss, but family members are worried about weight loss.
The point is, as long as the patient is, see now the HbA1c is normal, Sai Narendra. Fasting blood sugar is normal. PPBS is normal.
Yes.
GTT only showed a raise to
Yes,
level.
madam.
Am I right? Yeah. So here you can keep a close watch. Maybe this is a temporary rise
Yes, madam.
because the patient does not have any disease as of now, or the patient does not feeling, the patient is not having any symptoms. If it is a healthy reduction in the weight, it is always welcome. According to his BMI or according to his height, if the weight is coming into the proportion, you can always consider this as a good sign. And if the energy levels of the patient is good, you can again consider this as a good sign. But then you have to closely monitor the patient. And if maybe you have to repeat the GTT again and again, probably once in every 2 months or so, and keep the patient on track. Only if necessary, because if the patient's SORA is very good, the hypertension is still under control, that is really hats off to you, Sai Narendra. And if the patient is keeping up, like his SORA is really good, he will not jump into the diabetes. He will still be, his sugar levels will be normal. So you just have to follow this up properly. That's all. You don't have to change the medicine or immediately give another medicine and all. Maybe his own SORA will be able to correct it, Sai Narendra. Okay, that's where we are in this particular case.
Yes, ma'am. Thank you, ma'am.
Yes. So now, whatever symptoms are thrown out by the person, by the patient, you have to assess whether it is in the more important or the less important system or layer, and then conclude whether the remedy given is right or wrong. Our gullible homeopaths, starved of results, are ready to take in any new fantasy as a mode of prescribing, with the patient going to dogs. Worst of all, the results which are shown are all in the first two layers, example ectoderm, and most of them are functional, which would have subsided even otherwise. Any example? I have seen many doctors keeping the patients, no, like before giving the medicine and after giving the medicine. We are very interested in keeping the hard copies with us, no? Nowadays, it's gone to the soft copies. But then initially, no, I have seen many doctors keeping papers of curing ovarian cysts. And they had shown me the results also. This patient had come with fibroids. Of course, she was having an ovarian cyst also. And after giving the medicine, Ignatia, Sepia, Staphysagra, etc., very well selected, very well done the case taking, and did the repertorization and given single dose. After 2 weeks of or after 1 month of the medicine, when they repeated the scan, the fibroids are there. Symptomatically, the patient is better and the cysts are gone. They're so happy. Then I said, yes, cysts are gone means that's how it should happen. No, first the cysts should go. After that, only the fibroids will start improving. Why? Because the ovaries belong to which layer? Ovaries are again part of endocrine. That is the fifth layer. Whereas the fibroid, that is the muscular layer of the uterus, that comes to the organ or probably the muscles. That can be considered as the third layer. So, okay, the ovarian cysts are gone. Let me see the report. To my dismay, it was a functional cyst. It was a simple cyst. What is simple cyst? Simple cyst is nothing but a physiological cyst. It can be an ovulation cyst. During the ovulation, the corpus luteal cyst can be sometimes projected as 2 centimeters, 3 centimeters cyst. It is a functional cyst. After 2 weeks or after the menstruation, the cyst is gone. So with the next report, the cyst is not seen. And many doctors have kept like that. The ovarian cysts are gone completely. So it is not PCOD. It is only a simple cyst, simple cyst, that is physiological functional cyst. So why I told this was, many doctors, worst of the results which are shown are all in the first two layers, ectoderm and endoderm. Any cold and cough, throat infection or atopic dermatitis, any doctor would have got result for this. With homeopathy, you are supposed to treat all higher level of diseases. Don't project about the psoric first layer, second layer diseases as getting cured. Yeah, because any doctor can do that. So try to implement, at least if it is syphilitic cough or if it is a syphilitic kind of skin eruption, it is well and good. But if it is psoric, and as long as it is in the first layer or the second layer, it is bound to get cured all by itself, or even the third layer, a leg pain, it will get cured by itself, no? Yeah. So let us not be in a hurry to present our case. A real homeopath is the one who shows results in higher levels of suppression, like chronic diabetes, tuberculosis, tumors, cancers, terminal cases, etc., either eliciting Herring's law or showing compensatory cure. Herring's law is possible in most of the cases, but if the damage is irreparable, there is a scope of compensatory cure. So are we all ready with all this continuous medical education and with the hammering in of Vijay Kasar's theory into our head? Are we all ready to cure higher and higher layers? Just give me some indication. Let me check into your spirits. How good are you all? Huh? Do we all want challenging cases, grave cases, or syphilitic miasm cases? Be it in the first layer, second layer also. Yes, Arati, trying. Very good. Very good. This is the spirit. So let us all be motivated. Let us all take that motivation from Dr. Vijaykar sir. Huh? Let us get the blessing of Vijaykar sir, and let us all be able to treat higher and higher cases day by day. Yeah. In the above case, I had to select a simillimum, which was psychosyphilitic and representing the child as a whole. Child as a whole had strong general going through him, and that was violence. Yes, the anger was violent. The love was violent. How did he express his love towards his mother? He was pinching her cheeks and putting her into pain, no? And the cough was violent. A second most peculiar characteristic which strikes us is his attraction towards floor. He rolls on the floor when angry. He crawls on the muddy floor. He slides from any seat onto the floor. Yeah, we have dealt with all these rubrics in the last class, right? So violent plus rolling on the floor, and we get the following drugs. That is cicuta, proteus, sulfur, and tarantula. So again, our sulfur and tarantula are still there. Children who are violent and roll on the floor are the above constitutions. Now we want a constitution which is sensitive to public opinion about himself. This child had it, right? Though this child loved dancing, it would not dance in public. It is not that the child would just dance and fish for compliments, and if not given proper compliments, would become sad. Okay, so this child has got that desire for, what to say, compliments, right? Desire for compliments is there, or he cannot rather take any criticisms or corrections, right? At the onset itself, he was afraid of any compliments in fear. So it's not that he will allow anybody to see. Why is that? It is because of fear. Fear that he might be hurt. Hence, he danced in a closed room. He never dared to dance in public. For a destructive, angry, violent child, this small fear of opinion of others mattered, which was very contradictory and peculiar. So in a sensitive person, for example, if it is a silesia, or if it is Verita ambra, if it is a bashful remedy, you cannot give importance to this particular symptom because already they are bashful, already that is their innate characteristic, and they don't want to, so they don't have the courage to present it in the public, and they already have that fear of opinion that they will be judged, etc. Whereas this is an angry, violent, destructive, very confident remedy, but he has got this particular symptom. Here it becomes of a symptom of utmost importance. I hope you are all with me, guys. Why Vijay sir has taken this kind of a psychotic rubric, no? Like fear of opinion of others. For this case, it is 100% important because this is a very, very, very don't care kind of child, but then he cares for this thing. So that is a real important rubric. Fear of opinion of others in this case mattered, which was very contradictory and peculiar for this case. Taking fear of opinion of others as eliminating rubric, we are left with only one remedy, and that is Proteus. Now, honestly speaking, how many of you know about Proteus and how many of you have given Proteus in your prescription as your prescription in your daily practice? I have not done, and I don't know about Proteus. Yes, doctors. Now, retrospectively, Vijay sir is giving us never given. No, no, no is the answer. Even no is the answer for me also. Interesting. So let us see what this Proteus, what is the kind of remedy. It is a psychosyphilitic remedy. It covers suddenness. It is known as a cyclone. Yeah. Suddenness, restlessness, quarrelsomeness, offended easily, kill desire to, destructiveness, contradiction is intolerant of. So incidentally, it is the only remedy which has crawling, rolling on the floor, anger during. The other day itself, when we have gone through those repertorial rubrics like the after anger, rolling on the floor, etc., we have seen Proteus there. Along with Tarantula, along with Merck, we have seen Proteus there. But then never thought that it could be Proteus, right? So it could be dangerous to go from a small rubric towards similimum because the other drugs which also have rolling on the floor like cicuta, sulfur, tarantula, calcarea, opium, acetic acid and paeonia would never be considered. And if the generals of violence, suddenness and sensitivity was absent, then Proteus could never have worked. So you cannot just give Proteus based upon this rubric that crawling, rolling on the floor and take Proteus and give. No, Proteus has to be given only in such and such case where it needs, it is a real case of Proteus, which is justified by the violence and the suddenness and the extreme sensitivity. Thus, it is always better. What is the sensitivity here for Proteus? That it will be judged by others. Fear of opinion of others. That is the sensitivity here. Thus, it is always better and safer to consider a general rubric with a large number of remedies. Filter them down with thermals or a strong peculiar symptom. So here, what was the general rubric with a large number of remedy? We have taken violence. Vijay sir has taken violence. Combine that with a peculiar symptom that is rolling on the floor. Then we got some 4 or 5 remedies. Finally, use your material knowledge to zero in down on the similimum. And there we have added fear of opinion of others as the eliminating rubric, and we have zeroed down it on Proteus. Even this does not suffice. One has to retrospectively see whether the same remedy is getting confirmed by other strong generals, physicals, mentals, and miasms. In this way, a genetic constitutional similimum can be selected. Only genetic constitutional similimum can reverse the symptoms according to the Herring's law and cure the irreversible pathology and cure chronic diseases like hypertension, diabetes, etc. Yes, Sai Narendra, here is your answer. Chronic disease like hypertension, what was the miasm for that? Hypertension can be of 3 miasms. It can be psoric hypertension, psychotic hypertension, or syphilitic hypertension. If it was a syphilitic hypertension that you have treated, a psoric temporary increase in the sugar levels, that is a hyperglycemia, is a good sign. Don't worry that it has gone to the 5th layer. A temporary reduction, a temporary, that is what is that? The reduction in the weight, that is a good sign, as well as a temporary psoric fluctuating kind of a dynamic kind of change in the values. Small hyperglycemia can be considered as a good sign if it was a syphilitic hypertension or if it was a psychosyphilitic hypertension. And even now, if the BP is good and a very mild change in the GTT alone, whereas the fasting blood sugar is normal and the PP is also normal, HbA1c is also normal, I think it is a good sign, Sai Narendra. Yes. Cure chronic diseases like hypertension, diabetes, etc. Reverse disease process from psychosis to SORA or syphilis to SORA. That is all good sign. Psychosis to SORA and syphilis to SORA, all very good signs. And all this with single dose repeated infrequently. Yeah. So this is with predictive homeopathy only, guys. Now let us go into the follow-up. That is, violent cough is reduced. Yes. No spasms. Appetite is improved. The child is more amenable to suggestions. Rolling anger attacks reduced. So what is this? It is all a good sign, right? Syphilis going to psychosis. And SL was given. And in the next follow-up, violent cough is very few bouts aggravated around new moon, subsided on its own. So this is how beautifully the improvement has to come. It's not like a time bomb. The total disappearance should not be there. Slowly, 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 it should reduce and the general should improve. Here, the same thing has happened. The appetite is improved. The violent cough is reduced and a small amount of violent cough was there, no? Like very few bouts of violent cough, which was aggravated during new moon, and it subsided on its own. What does that mean? His own immunity is developing and there is no sleep disturbance. Yeah. Again, that is the syphilitic miasm is gone now. And the patient mentally also, he is more open to suggestions now. Appetite is good, weight is increased, hoarseness of the voice is reduced, and this is slowly coming from psychosis to SORA. And 15 days after another follow-up, it is the same as above. And then the next month, mild cough started. What is this cough? Mild cough, not the violent cough, not the night aggravation cough, not disturbing the sleep. What cough is it? What miasm is it? What miasm is it? It is soric cough. This cough, the mother said, let me interfere here. When you are treating a syphilitic RA with lot of crippling and all, once I had a patient like that. He was an army person. He had come on leave. He had come on a medical leave. He could not continue there. In the cold, hostile weather, his fingers all gone crippled. And he was having pouring of scalp psoriasis as well. His name was Tyagarajan. And I had given him Aurum Met. He was having typical night aggravation pains. He cannot sleep in the night. And after giving Oromet, what happened? All the crippling went off. The pains went off. He started sleeping in the night. He was very happy, smilingly coming up. But then the pouring dandruff was even more. What is that? It is all scaling, no? Like it is all coming up, the thickening of the skin. It is all getting cleared up. So it is from the syphilis to the psychosis. I explained and I made them wait. And eventually he was wondering about the psoriatic arthritis. I gave him confidence. Don't worry, all this crippling, everything is gone. Now the psoriasis will get cured from above downwards. He was having it on his body also. And as mathematically explained by Vijayakar sir, everything went off according to the miasm and that too above downwards. And when it was time for celebration, okay, this patient is completely cured. There is no crippling of joints. There is no night aggravation. The patient is very nice now. His generals are also good and he is ready to go to the army. He started getting the pains again, the joint pains. So what is this joint pain? This joint pain was not in the nights. This joint pain was, he went to the supermarket to purchase things. He carried so many things that day. And he stood for long in the AC in the supermarket along with his newly married wife. He was very interested. He was very happy that he was taking his wife also to Assam. He was carrying with the letter from the army, wanted to go, and then he was devastated that again my joint pains, again my joint pains. I asked what happened. Without any emotions happening, this cannot come back, I said. He said, no emotion, I am very happy only. Nobody criticized me. I am not sad. In fact, I'm very happy. But then after this joint pains, I'm afraid now. I can't go into that hostile environment. Okay, I thought that is it anticipatory anxiety? Then I asked about the history and he said, yesterday we went, the wife said the clear-cut picture will be always given by ladies, no? We went and we stood in the supermarket for many hours together, purchasing happily things and walking and carrying all these things. So what is this? What is this? Which miasm? Which miasm? Yes, Adira is saying it is soric. Arya is saying it is soric. Yes. So is it a good sign or a bad sign? Sufaira is saying it is soric. If it was a syphilitic thing, just like the patient is always, yes, doctors, you are all with me. Thank you for that. What will the patient, what is the fear of the patient? Whether it will take him back to the old syphilitic crippling joint pain. No, that will be the fear of the patient. And with this fear, what the patient will do? Now the patient is in the soric miasm. What does Sora do in the mind? Irritation. They will come and eat our head and ears. No? No? They will shout at us, they will cry, they will show all sorts of emotional commotions in the chamber, in our chamber. Whereas when it was in the syphilitic miasm, what was the expression of the patient? That much only. The patient will not even talk. It's all on the expression, the agony. Doctor, it is paining. That's all. And it will be kind of a begging. Begging. Which are the medicines?
Pulsatilla.
Pulsatilla. Yes. Platina, Arya, yes. 4 or 5 metals are there in begging. One is oromet, yeah. Another one is plumbamet, yes. Another one is tannamet. Another one is platina. 4 metals. Then one plant, that is pulsatilla. Then one calicarb is there. Then stramonium is there, a drug remedy. Lysinum is there. Some 10 remedies are there. 2 more remedies. Anybody quickly? Arsalb is there. One more remedy. Can anybody look into the repertory? This is how we learn. Begging. What are the metals there? Aurum, plumbum, stannum, platina, belladonna. I think yes. It is belladonna. So this is how you can. Yes, calicarb is already written, Sai. Thank you. So this is how you learn a rubric. How many? Because begging is a syphilitic rubric. So you have to keep it in your brains. At that time, you will be able to crack the case. What is this patient's job? He's at the army and he wants to save the country. And because of the hostile weather and because of the hostile, so many things, no? So he could not sustain there. And that was the reason he would have felt helpless. He would have felt all sorts of self-devaluation conflict. And that was the reason. How to find begging in the clinic? Very good question. Ma'am is begging to relieve their complaints. That is psychosis. Begging to relieve their complaints is psychosis. That you should be able to judge, Dr. Kairvedi. So there was an interesting case of 2 cases I shall give you for this rubric, begging. So you can keep this in your mind. A case of an epilepsy shown by Dr. Ambrish sir was like the patient, it was a lady. During the attacks, she was like, what is this? This is pronation and this is supination, right? Like her hand was like this. It was kind of a jerk. The jerk is happening all over the body, and then she will turn to one side and her hands will be like this, shaking. What is this? This is like shaking of a beggar, no? So with this rubric, he picked up with this symptom, Ambrish sir picked up the rubric by just seeing the video. He picked up the rubric begging. It is a syphilitic rubric. And out of this, he took the case history. One rubric was for sure right one, no? And then he took the case history, the mother's history, etc., etc. And then during the pregnancy, when the mother was carrying this girl child in her womb, the mother was bankrupt and she was kind of begging for food or for money or to begging to her own family members, etc. She had to beg for money. So out of this, the remedy pulsatilla was taken, and pulsatilla, I think 200 single dose was given, and the fits was gone. I don't know what potency was given. I don't remember. According to the miasm, only the potency would have been judged there. So here, pulsatilla did the job. Another complaint of begging, which is coming to my mind is, one of my friend doctors, Dr. Shoyson, had presented this case once, where in his clinic, there was one liver failure case, I think, and this patient was kind of lying on the floor. And when doctor was coming into the clinic, this patient was like, "Doctor, please help me," kind of thing. Like it was a cirrhosis kind of some deep pathology case. So he had narrated this case once to me. So here he has taken the rubric begging for cure. The person was a very top official, and after retirement, something and all happened in his family. A lot of conflicts were there, and finally he was almost going to die. So he was like kind of like this. He was praying. Even arsenic album also, no, like, doctor, please. This will be the pleading of ourselves, no, doctor, please do something to help me. Like that, no, that anxiety for health will be shown in the form of begging. And here in this case, this patient also was gracefully begging this Oromet. He did not beg, "Doctor, please," and all. He did not cry. If it is Pulsatla, then it will be all in tears. And plumbum will be little bit of grace will be there, but plumbum is a rather a weak remedy, right? And how will the stannum present? With the cough only, or with some chest infections, or with cancer of the lungs, or some typical pneumonia. And the patient will tell, no, where the oxygen saturation is so low, the patient may sometimes beg, "Doctor, please try to do something for me." The patient will be talking like that, no, with the weak chest. So according to the symptoms, so begging, only 10 remedies are there. Now, I hope you are all by heart with the begging rubric now. Kali car begging, how Kali will beg? He will irritate and beg, no? He will quarrel with his bread and butter. He will come here and then he will say, "I am not getting any better. You have been treating me for the past 7 months and I did not get any better. And please cure me, doctor. Please cure me. I don't want to go to any doctor. You only have to cure me. I'm 100% submitting at you." This will be the kind of dialogues. And we will be, what is this patient kind of feeling we will get, no? So that is a begging of Calicut. Belladonna, again, crying for help, no? Crying for help. Delirium, crying for help. And begging. That is belladonna. That can be in maybe when the patient is in severe pain, no, some acute abdominal pain, delirious with pain, delirium crying for help, or in some psychiatric ailments. That is belladonna. Anything will be violent there, no, for belladonna. So where were we? Yes, after the syphilitic rheumatoid arthritis is gone, the psoriatic rheumatoid arthritis comes up. We cannot say that psoriatic rheumatoid arthritis. You can just say that it is a psoriatic kind of pain, arthralgia. There will be no severe inflammation and all. But then how do we judge that it is a psoriatic miasm? Because it comes in the daytime and it comes after exertion. After carrying the weight or after standing for so long, he gets a back pain, he gets a knee pain. And after carrying the weights, he got the pain in the fingers. So all these things are typical psoriatic then. So I assured him and then he is doing a nice job there at the army, bless him. So now, so this cough is much different from the previous cough. Our small friend also got the cough back, but it was a psoriatic cough. There was no violence. It was more on waking in the morning. Yes, it was superficial voice morning. It was superficial voice. Normalized weight. Superficial voice normalized. Weight increased marginally. Child is more active, less destructive, taking interest in studies, and has considerably changed. So the child, no, I have seen this very much in Vijay sir's camps and all, where the mothers will come and cry when they thank to Vijay sir profusely from their heart. They will say that, "Doctor, now my child is looking like a human being. After giving the indicated remedy, all the syphilis from the child's behavior and the child's face, the child's structure, all those syphilitic things have gone. All these years, doctor, my child was looking like a ghost. Child was looking like a very bad thing. And now my child is looking like an angel, doctor." So how much can the mothers thank? No words can do that, no? Why is that so? The sora is coming back. By the look on the patient or by the behavior, by the smile, by the attitude of the child, you know that the syphilis is gone. Okay. and he does not dirty his clothes. He has become more concerned about his belongings. So all these things are nothing but sora coming up. And what? The next follow-up, he developed boils on the skin. The rest, general, everything is okay. And then in the next follow-up, the boils are lesser, it is drying up all by itself, and generally the patient is okay, the child is okay, that is soric. Okay, dears, wasn't it a great case? Now it is already 10:50. So 10 minutes for the doctor who is presenting today. I forgot totally.
Yeah, Dr. Kyle.
I shall go into mute now.
Ma'am, good morning. Good morning, everybody. This is the acute case what I'm presenting today. The patient girl, lady, 37 years, Jay Nitya, she's named, and she came with a complaint of right-sided headache since 10 days. It was more on the occiput region and vertex. So she was telling that the cold air is aggravating her headache. Again, another complaint what her husband told was she was having a short-term memory loss. Like since 2 days, she is forgetting everything. Like she has forgotten her own relatives, who is her mother, who is her I mean, only husband she can recognize. Others all she could not recognize. Like other relatives, her children, her parents, everything she's not able to recognize. So that was a problem for her. So I asked her what happened exactly. So he said she's little sleepless also since 10 days. And because for the headache also they have taken some allopathic and some other homeopathic medicines also, but she was not much better. When I asked about the history, she said 10 days back, she's working as a Anganwadi worker. She's Anganwadi teacher. So there she was doing some duty, election duty, and she has to arrange some forms and these things. So some politicians harassed her for the forms, for getting the forms, or some harassment was there. So she was disturbed from that time itself. She was disturbed. She was getting headache and she was having a sleeplessness, all this. And again, since 2 days back, only she lost her memory actually. So I asked her what exactly happened 2 days earlier. So her husband was telling that she was some auditing work was going in her school, and that auditing she has to answer many questions. So auditing means all things will be questioned and they have to give proper explanation. All so she was little stressed out, and maybe I don't know what was. They didn't exactly tell what was the problem, but she was disturbed from that auditing, from the auditing which has happened in the school. And after that only she started forgetting people, forgetting everything. So she was asking repeatedly, asking questions to her children, like whether they had food, what food they had. Again, after 10 minutes, she's asked, repeating the same question, what you had on that. So only this much was the history given to me, and she was a new case also. So I just asked her about her general nature. He said she's quite a calm type, little fearful nature only. She's not very bold or something. She's a very calm person. That was the thing. And one more thing she was telling was she was having some delusions also, like falling down. I have fallen down. It is bleeding. All that she was telling, but nothing was true actually. And when she came also, she didn't talk much. She was just keeping quiet. She was the only complaint she was telling was headache, headache. She was just holding her head and she was just lying like this, my headache. But I felt it was more of psychosomatic. I concentrated more on her, like that memory loss, which was very acute, and she was not able to recognize anybody. So, taking that into consideration, I've taken two rubrics actually. Ailments from fright, because somewhere she has been afraid, like got frightened because of that auditing and also of the politicians behavior. So another thing I took rubric as recognizing does not recognize his relatives. So that was the two rubrics I've taken. In that medicine, common remedy was actually only opium. Sorry, common remedy was bell, glonine, hyoscyamus, lacusis, opium, and stramonium were the remedies which was coming. So actually, I took as opium because she was more contented, like she was not complaining anything else. She was only telling of the thing. And other remedies, bell, glonine, hyoscyamus, and she was not of that kind. I asked him whether she was behaving any violently, she's throwing things or anything like that, any abnormal behaviors. He says nothing. She just keeps quiet. She just forgot everything. She's not violent or something. So I just took the remedy as opium. And after I think predictive, I have the full confidence to. I prescribed her opium 10 ml, just one dose I gave her. And I just told her husband, she may get a milder headache will reduce slowly, but she may get a milder symptom like a cough, cold, or some diarrhea, or some things may come up. So I just told him, just don't go to any other doctor or any local doctors, or you just don't give any other medication, because the memory problem may reverse. So just take the medicine, and I've given some SR also. So I've given this on 13, and she was back on 16. Headache is there, but reduced, intensity has reduced, and sleep is now better. She's sleeping well in the night, and the memory is back to normal. She's recognizing everybody, and she's normal with the children, everything, doing her works, everything was okay. And then again, I told him, I just cautioned him, she may get a cold or cough or something like that of kind. So just wait for it, don't interfere. So again, after 4 days, he called me. Headache is almost reduced, very mild she's having, but the loose motions is there. 2-3 times she has passed the loose tooth. Then I told him, better to wait. You report after 2 weeks. Don't give any medicines. Maybe some home remedies. I just told her you can take food like that. Don't give any other medication. So after that, she's completely better. I'm waiting for the other follow.
Yes. Very nice case explanation of very nicely put, Kyle. First of all, congratulations to you that see now you people have gained the confidence to give opium 10 ml. See the
Yes.
potential, the confidence of Dr. Kyle. I'm so happy, dear. So very nicely handled. And how mathematically you were following up the patient that you want to get all the symptoms, and the patient is also coming up with all those things. So we are able to see, we are able to keep this hearing slow as a measuring tool, right? Like how much
Yes.
oximeter, pulse oximeter we will see. With the BP
Yes.
apparatus, we will measure. Similarly, you can keep this as a measuring tool, the hearing slow. Do we need to rule out any pathological cause? If the patient is all well,
Actually, 10 days I told no, ma'am. That time they have taken a MRI also out of fear, because she was having a constant
okay,
headache. That was quite normal.
yes.
So
So you need
that I had that confidence. It was a very acute problem. So
so
I didn't.
ailments, Sai Narendra is saying, so ailments from was taken because it is an acute case, and
Yes.
reaction of the patient very nicely considered. Like the patient was not crying out for help and all. The patient was not violently reacting or over talking was not there. The patient was rather silent, and the patient was rather contented. No, like it was not exhibiting. That is the meaning of contented here. No patient will be contented with the pain. Everybody wants to get rid of the pain only. Even opium is not enjoying the pain. But then the expression will be much lesser. With opium, the dullness will be seen, and kind of they will be sitting quietly, allowing the other person to talk. So this
Yes,
is a typical picture of opium. The dullness will be seen in opium. And with the pain also, it is not expressed out nicely. So when you get opium in that, well and good. Why not? Delirium recognized no one also has opium. Yes. So that was the, once again, can you repeat the rubrics, Kyle? One was ailment.
Ailments from fight was one thing, ma'am. The next one is recognizing does not recognize his relatives. That itself is a rubric.
Yeah.
And retrospectively, I saw another rubric also, ma'am. Delusion, injury, like about to receive an injury. In that, only remedy is opium.
Okay. Good.
That I like falling down, I'm getting hurt, all that she was telling.
Yes. Good. Any doubts? Can we all meet again in the next week then? Hope you all had a wonderful Christmas yesterday.
Yes, ma'am.
Waiting for the new year to come, no? Wishing you all a happy new year then.
Thank
Have
you,
a
ma'am.
nice day, guys.
Happy New Year.
Yeah.
Thank
Thank you, ma'am. Same to you.
Thank you so much.
Thank you so much. Thank you.
Mhm.